Hello, this is Dr. David Green, CEO of the California Pain Network. The topic today is an overview of RSD and CRPS. RSD stands for Reflex Sympathetic Dystrophy, and CRPS stands for Complex Regional Pain Syndrome. They really are the same term, but it's changed over the years. Both represent chronic pain neurologic syndromes that are very frustrating to both patients and doctors. The basic problem is an overactivity of the sympathetic nervous system that results from either a trauma, surgery, or sometimes an unknown cause. In the mid-90s, the International Association for the Study of Pain changed the name from RSD to CRPS to try and better characterize the condition. However, both terms are still used widely. How common is the problem? The total numbers are unclear, but somewhere between 5 and 12 million Americans suffer from RSD. 3/4 of those afflicted are female, and it's just unclear why it occurs. It definitely involves overactivity of the autonomic nervous system, specifically the sympathetic part of the autonomic nervous system. The trigger, whether it's surgery, trauma, or something minor, sparks up the autonomic nervous system, and it just doesn't shut down. So the symptoms are going to range broadly. It can be severe burning pain that is intense and much stronger than would be expected for the injury that's been sustained. And the pain typically gets worse over time rather than better, as you would expect. It starts at the point of the injury, but it spreads to potentially the whole leg or the arm. It can even spread to the other side. Patients often have significant sweating, swelling, extreme sensitivity to the affected area. And in later stages you can get bone and skin changes and also insomnia and emotional problems. What are the stages of CRPS? There's actually 3 stages. The first one is skin and temperature changes, muscle spasms, severe burning pain that worsens with even a slight touch, hair and nail growth that is faster than normal, and then the beginning of some skin changes. You can see skin that's blotchy, pale, shiny, sweaty. When you move into stage 2, you start to have more skin changes and cracked nails. This is in 3 to 6 month phase. Pain continues to get worse. Hair growth that was prominent in stage 1 slows down, and then you start to get weakening muscles and stiffening joints because it hurts so much to move it that you're getting atrophy and stiff joints. In stage 3, that's when it starts to become irreversible. You get muscle wasting, entire involvement of the leg or the arm, and then contractions, which is not just a stiff, it's actually it's unfixable. The soft tissues are stuck. So what are the treatment options? Well, it's very hard to cure RSD, but it can be slowed and reversed significantly. Physical therapy often can work very well for nerve desensitization, increasing range of motion, decreasing of pain. Medications may include any number of things, narcotics, antidepressants, blood pressure medications, nonsteroidal anti-inflammatories, steroids, neuropathic medications such as Neurontin and Lyrica, and even calcitonin. Now keep in mind, a lot of these medications are used off-label for this condition, but that's often what works. I think over like 50% of medications are used off-label for something. So interventional procedures may include lumbar sympathetic blocks for the lower extremities or stellate ganglion nerve blocks for the upper extremities. A surgical sympathectomy can remove the sympathetic nerves. As a last resort, a spinal cord stimulator or an intrathecal drug pump may be necessary. What are the treatment outcomes with RSD? Well, it depends on timing. Pretty much every study has shown that earlier treatments work better. A large study in the 1980s out of Journal of Bone and Joint Surgery showed that if treatment was started within 2 years of onset, you get an 80% positive outcome. And now we have even better treatments, so you can expect even a higher positive outcome. Treatment from 2 to 5 years showed a 70% positive response rate, and then once you get over 5 years, it's very tough to get a good outcome. A more recent study looked at spinal cord stimulators for RSD in over 50 patients and showed extremely favorable long-term outcomes. There were some minor complications. The newer spinal cord stimulators actually work well when laying down and moving to a standing position. The older ones just didn't respond well to those shifts in movement, so you can get very good outcomes. Lumbar sympathetic block and stellate ganglion blocks involve anesthetic being injected into the area around these ganglia It does warm the skin immediately in either the arm or the leg, depending on which area is being treated. That's when you know that it worked, that it was put into the right place. Pain relief may occur within a half an hour, and it can last for days to weeks. A patient may need 1 to 2 blocks per week with about a series of 5 injections to permanently relieve symptoms. And if that works and then wears off and a person's had 3 to 5 injections, it may be that they want to undergo an operative sympathectomy to get hopefully permanent relief. So it's a complicated condition, and there's a lot that we don't know about them. So combination of treatments, individualized treatments are typically best and lead to the most successful outcome. The goal is to break the cycle. There's a cycle of sympathetic nerve overactivity, and what you want to do is somehow break that overactivity cycle and reduce the ongoing pain. So one set of treatments is not going to be effective in all patients. It may be that it might be the third, fourth, fifth treatment option that really does make the difference. The top pain management clinics in California are affiliated with the California Pain Network. There's multiple clinics throughout the state. Over 50 insurances are accepted with over 25 treatment options provided. Overall, the average success rates for pain relief and avoiding surgery are over 90%, and the pain doctors are board certified and award winning. Visit us online today at californiapainnetwork.com, and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green with the California Pain Network. Your pain stops here.